Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. The subject of this article is, what does HIV virus teach us about heart disease? My oxygen model of heart disease asserts that the fundamental cause of heart disease is oxygen dysfunction. Dysfunctional oxygen signaling, dysfunctional oxygen detergent functions, dysfunctional oxygen detox functions, dysfunctional oxygen-driven ATP energy generation in mitochondria, and dysfunctional cellular repair after injury. Now, at a lower level than this, my oxygen model of heart disease predicts that heart disease is an inflammatory problem. And any condition where there is chronic inflammation, you would expect heart disease to develop more frequently at an earlier stage in life and progress more vigorously than in other people. On June 19th of 2012, the front page of the science section of the New York Times reported that heart disease occurs in patients infected with HIV/AIDS virus at an earlier stage, sometimes in 30s, more often in 40s, and it progresses more rapidly even when the virus count is low due to antiviral and other therapies. Well, regardless of what is the source of chronic persistent viral inflammatory response, even when your viral count is low, indeed viruses are evoking an inflammatory response. So the oxygen model of heart disease prediction that any source of chronic inflammation, whether it is at molecular level, energetic level, cellular level, tissue level, or organ level, it's going to cause more disease. And so one would have predicted, as I did many years ago, when I proposed my oxygen model of heart disease, that HIV is now being documented. Of course, they would say that we need more antiviral therapies. They are not going to focus on natural antiviral spices, herbs, oxygen therapies, hydrogen peroxide foot soaks, anti-inflammatory oil drops, castor oil, sesame, mustard, bowel detox, liver detox. In other words, they will only go, the New York Times will tell its readers to get more and more antiviral drugs and anti-inflammatory drugs, but the New York Times is not interested in educating its readers about the fundamental scientific facts of heart disease. For my professional readers, I would recommend 6th volume of my 12-volume textbook, The Principles and Practice of Integrative Medicine. The title of that book is Integrative Cardiology and Chelation Therapies. This is a large volume. I give you more citations than you can handle if you're a professional. For the regular viewers, I would suggest, if you have had stents or bypass, or if you're interested in deepening your understanding, please look at other video segments in this encyclopedia. You may also want to support our vision at Children's Health Core to provide authentic information free of cost to people all over the world by ordering my 90-minute video seminar on reversing heart disease. You can get it by visiting www.majidali.com. That's MAJIDALI.com. Thank you for joining me, and please do so soon. Thank you.